So now we have new data that that are really pretty important. So maybe, Mo, could you maybe summarize the DB11 trial for us?
Yeah, DB11 was a neoadjuvant trial. It has 3 arms. The control arm was the standard, which is THP AC. Well, I think they started with AC and then THP. And then there was a T-DXd-only arm, which was stopped early. And then there was a T-DXd followed by THP arm. And this is the arm that reported in recent months and demonstrated a significant improvement in pathologic complete response over the arm that contained AC, and that around 15% improvement in PathCR is really what prompted this new approval. Very interestingly, because there are only 4 cycles of T-DXd, we did not see some of the concerning side effects like that, particularly of special interest, like pneumonitis with the frequency that we saw in other studies. And that really led to the FDA approval, which was a more broad approval for all patients with stage 2 or 3 HER2-positive breast cancer to use T-DXd essentially with THP or followed by THP in the neoadjuvant treatment.
Yeah, it was interesting. It was not powered, for a primary endpoint of event-free survival, but
it was not.
But yet the curves are splitting apart nicely. I think they got 3-year follow-up, and it was like 96+% versus 93 was more than 3% absolute improvement, right, at just the 3-year mark. So clearly headed in the right direction. Yeah, the 8 cycles of the T-DXd had a lower PathCR rate than the standard of care arm, the AC THP. So it looked like, but the winner was the 4 T-DXd and then the 4 THP in both the ER negative and in the ER positive. The delta was even more impressive. Was it 16% or something like that in the ER negative, and maybe 11ish or 9, 10, 11% in the ER positive group?
Which is a trend we've seen in all neoadjuvant trials, where the ER negative HER2 positive group, which may be more chemosensitive, maybe more HER2 driven, maybe more kind of that HER2 enriched subtype, tend to be more sensitive to the treatment, which kind of puts us in the paradoxical position of like the ER positive, HER2 positive have a lower PathCR rate, which kind of takes them more into the category of adjuvant ADC, which we will talk about. But yeah, that differential in benefit was present there. And the T-DXd only arm was really interesting. I think many people have seen so much success from T-DXd in prior trials, felt like, what? Why did this not pan out? And I just wonder, had that arm had T-DXd plus P, if the results would have been different, because it's hard for me to think that TH is what is better than T-DXd. It may be, but I think that the difference between the 2 arms is really the presence of pertuzumab in one and not the other. It was just speculation, probably, but I just wonder, had there been that, would the results have been different? But definitively, the way the trial was done, the T-DXd arm was, not a winner. It's the T-DXd followed by THP that really achieved those positive results.